Hello and welcome. Today we're delving into the complexities of gallbladder cancer, a relatively rare but often aggressive disease of the digestive system. We'll explore its causes, how it develops, how it's diagnosed, treated, and what you can do to potentially lower your risk. While this information is for educational purposes, always consult with a medical professional for personalized guidance. The exact cause of gallbladder cancer isn't fully understood, but several factors are known to increase the risk. Chronic inflammation of the gallbladder, most commonly caused by gallstones, is a major culprit. Other potential contributors include porcelain gallbladder, which is calcification of the gallbladder wall, coliacal cysts, which are abnormal dilations of the bile ducts, and chronic infections, such as Salmonella typhi. Genetic predisposition and exposure to certain chemicals may also play a role. It's important to remember that having these risk factors doesn't guarantee you'll develop gallbladder cancer, but it does increase the likelihood. Gallbladder cancer typically begins in the inner layer of the gallbladder wall and then spreads. The chronic irritation and inflammation, often from gallstones, can lead to changes in the cells lining the gallbladder. These changes can cause the cells to grow uncontrollably and form a tumor. As the tumor grows, it can invade deeper layers of the gallbladder wall and eventually spread to nearby organs, such as the liver, bile ducts, and lymph nodes. Cancer cells can also break away from the primary tumor and travel through the bloodstream or lymphatic system to distant parts of the body, leading to metastasis. Gallbladder cancer is considered a relatively rare cancer, accounting for a small percentage of all cancers diagnosed each year. It's more common in certain geographic regions such as South America, Eastern Europe, and parts of Asia, potentially due to diet and environmental factors. Women are diagnosed with gallbladder cancer more often than men. The risk also increases with age, with most cases diagnosed in people over 65. Certain ethnic groups, including Native Americans and Hispanics, also have a higher incidence of gallbladder cancer. Unfortunately, gallbladder cancer is often asymptomatic in its early stages, making it difficult to detect. When symptoms do appear, they are often vague and can be mistaken for other conditions. These symptoms may include abdominal pain, particularly in the upper right quadrant, jaundice, which is yellowing of the skin and eyes, nausea and vomiting, loss of appetite, unexplained weight loss, bloating, and dark urine. A palpable mass in the abdomen may also be present in advanced stages. It's crucial to seek medical attention if you experience any of these symptoms, especially if they persist or worsen. Diagnosing gallbladder cancer often involves a combination of imaging tests, blood tests, and biopsies. Imaging techniques such as ultrasound, CT scans, and MRI scans can help visualize the gallbladder and surrounding structures, identify tumors, and assess the extent of the cancer. Blood tests may be performed to check liver function and look for tumor markers, such as C19-9. A biopsy, which involves taking a sample of tissue for microscopic examination, is necessary to confirm the diagnosis of gallbladder cancer. This can be done through endoscopic retrograde cholangiopancreatography, or ERCP, or during surgery. Gallbladder cancer can be classified based on several factors, including the cell type, grade, and stage of the cancer. The most common type is adenocarcinoma, which arises from the glandular cells lining the gallbladder. Other less common types include squamous cell carcinoma and small cell carcinoma. The grade of the cancer refers to how abnormal the cancer cells look under a microscope. The stage of the cancer describes the extent to which it has spread, and it's a key factor in determining treatment options and prognosis. Staging typically follows the TM system, which considers the size of the tumor T, the involvement of lymph nodes as N, and the presence of distant metastasis as M. The primary treatment for gallbladder cancer is surgery, ideally involving complete removal of the gallbladder and surrounding tissues, including the liver tissue adjacent to the gallbladder bed, lymph nodes, and potentially part of the bile duct. For early-stage cancers, surgery alone may be curative. However, for more advanced cancers, additional treatments may be necessary, such as chemotherapy and radiation therapy. Chemotherapy uses to drug cancer cells, while radiation therapy uses high-energy rays to target and destroy cancer cells. Palliative care, which focuses on relieving symptoms and improving quality of life, is also an important part of managing gallbladder cancer, especially in advanced stages. While there's no guaranteed way to prevent gallbladder cancer, there are steps you can take to reduce your risk. Maintaining a healthy weight, eating a balanced diet, and avoiding smoking are generally beneficial. Managing gallstones and other risk factors, such as coliacal cysts, may also help. For individuals with a porcelain gallbladder, prophylactic removal of the gallbladder may be considered. Regular check-ups with your doctor can help detect any potential problems early. The prognosis for gallbladder cancer varies greatly depending on the stage of the cancer at diagnosis. the patient's overall health, and the response to treatment. Early-stage cancers that are completely removed surgically have the best prognosis. However, because gallbladder cancer is often diagnosed at an advanced stage, the overall survival rate is relatively low. Researchers are actively investigating new and improved treatments for gallbladder cancer, including targeted therapies and immunotherapies, which harness the power of the immune system to fight cancer. Clinical trials are also exploring new ways to detect gallbladder cancer earlier and improve outcomes.